Right now, a woman with a copper IUD could walk into a high-end medical aesthetic clinic in Denver, ask for a popular tissue tightening procedure, and be warned that doing so could cause severe internal burns.
Right.
But then she could walk out, get on a plane, fly to another highly reputable clinic run by a top specialist, ask for the exact same treatment, and be told, it's completely perfectly safe.
Which is, it's an incredibly frustrating reality for anyone trying to make an informed medical decision. You're dealing with two completely polarized protocols for the exact same combination of technologies.
Yeah, and that is exactly the mission for this deep dive. Welcome in, everyone. We are taking a stack of clinical guidelines, manufacturer protocols, and official FDA labels to answer one highly specific question for you. If you have a copper IUD, are you eligible for radiofrequency vaginal tightening?
It's a huge question right now.
It really is, because as non-surgical aesthetic gynecology explodes in popularity, women are looking for solutions for, postpartum recovery, menopause symptoms, incontinence. But if you rely on the copper IUD, the medical community seems profoundly divided on whether you can safely access these treatments. So let's start by unpacking the two technologies colliding here.
Yeah, so we should probably look at the copper IUD first. Brands like Paragard, they use a small T-shaped piece of flexible plastic that sits high up inside the uterine cavity.
Right.
But the critical detail for our discussion is that the stem and the arms of that T are tightly wrapped in a thin, solid copper wire. It's a completely hormone-free birth control method.
Meaning it relies purely on the physical properties of the metal, right?
Exactly. That copper constantly releases ions into the uterus, which creates a localized inflammatory response that is incredibly hostile to sperm.
Just stops them in their tracks.
Right. It disrupts their motility, prevents fertilization. It's highly effective, lasts for up to 10 years. And for millions of women, it's just a foundational piece of their reproductive health.
Absolutely. But then we introduce the second variable here, which is radiofrequency, or RF, vaginal tightening. So we're talking about devices like Thoneva, Empower RF, Formava.
Yeah, these are energy-based devices.
Yeah.
The core mechanism is using controlled thermal energy, specifically radio waves, to gently heat the tissues of the vaginal canal and the vulva.
Okay.
And when we talk about heating tissue, what we're actually talking about is making the polar molecules inside your cells, primarily water molecules, vibrate millions of times per second.
Right, and all that microscopic vibration creates friction, and friction generates heat.
Exactly the same basic physical principle as a microwave oven, actually, just, applied in a highly controlled, localized, and much gentler medical setting. When the tissue reaches a very specific temperature threshold, two things happen. First, the existing collagen fibers contract, giving an immediate tightening effect.
Oh, nice.
Yeah, and second, that heat essentially tricks the body into a healing response without actually injuring the tissue. It stimulates fibroblasts, which are the cells responsible for producing brand new collagen and elastin.
And that structural rebuilding is life-changing for patients.
Right.
Right. It drastically improves local blood flow, increases natural lubrication to combat dryness, tightens the vaginal wall.
Oh, absolutely.
It's even used to treat mild stress urinary incontinence, which is, that little bit of leakage you might experience when you laugh or sneeze because the pelvic floor needs support.
Which so many women deal with.
Exactly. But basic physics paints kind of a terrifying picture when we combine these two things, doesn't it? We are talking about applying radiofrequency heat near a piece of solid metal sitting inside a human body.
Yeah.
And everyone learns the hard way that you never put metal in a microwave because it sparks and catches fire.
Right, and that intuition points directly to a physiological concept called selective heating. That is the absolute cornerstone of the strict no camp in the medical aesthetic community.
Okay, selective heating.
Yeah. In medical literature, generating heat inside body tissues using high-frequency electromagnetic currents is called diathermy. And the medical algorithm's guidelines on therapeutic diathermy outline a severe risk when metal is involved.
Because metal is just packed with free electrons, right?
That's the exact mechanism. Soft biological tissue absorbs radio waves gradually, and disperses the heat, but metal acts fundamentally differently.
Right.
When radio waves hit the copper wire of an IUD, those free electrons within the metal begin to oscillate violently. The metal conducts and concentrates the electromagnetic energy far more rapidly than the surrounding tissue.
Oh, wow. Which means the IUD acts almost like an internal antenna or a lightning rod.
Exactly like a lightning rod.
So instead of the gentle, diffuse warming we want for collagen production, the copper wire rapidly spikes in temperature. You risk creating a localized thermal hotspot that could essentially literally burn the surrounding uterine tissue from the inside out.
And that's why the clinical guidelines from several prominent sources treat this risk as an absolute non-negotiable barrier.
I mean, it makes sense.
It does. If you look at the protocols for that clinic in Denver we mentioned, the one utilizing the Empower RF system, their documentation warns patients that copper IUDs will conduct heat from these treatments in a way that is highly inadvisable.
Oh, wow.
They state you can have any kind of IUD as long as it is not the copper one.
And we see that same hardline stance internationally, too. Like, the PHI clinic on Harley Street in London explicitly lists intrauterine devices, specifically the copper coil, right alongside cardiac pacemakers and metal hip implants as strict contraindications.
Which is wild.
It is. They are treating a tiny piece of birth control wire with the same level of danger as a major metallic joint replacement. And we also found protocols for the UltraFem 360 procedure from a clinic in Franklin, Tennessee, explicitly banning patients with a copper coil in situ. So if I'm a patient reading this or, clinic director looking at the physics of electromagnetic oscillation, this seems like an open and shut case. Metal plus radio waves equals internal burns.
You really would think a risk of internal organ burns would universally settle the debate. But the reality is entirely fractured.
Really?
Yeah. Highly reputable sources and practitioners operating different devices argue that having a copper IUD is completely safe.
Wait, what?
Yeah. For instance, Dr. Suleiman Esserdas, who runs a prominent clinic utilizing these therapies, clearly states in his patient literature that RF can be performed on IUD users without any need to remove the device.
But how? The physiological physics can't simply stop existing when you walk into a different clinic. How is anyone justifying putting radiofrequency energy near a copper coil?
Well, the defense relies entirely on human anatomy, and the most vivid explanation of this actually comes from the FAQ documentation for the Thermiva RF device.
Okay, what do they say?
Their argument hinges on the fact that the IUD and the radiofrequency wand are never in the same room, so to speak. The wand is inserted into the vaginal cavity, but the IUD lives higher up, securely inside the uterine cavity.
Right, and separating those two cavities is the cervix.
Exactly. And the Fulmiva FAQ uses this brilliant metaphor for the cervix. They describe the thick, dense, firm muscle of the cervix as acting like a bank vault door.
A bank vault door, I like that.
Yeah. The scientific principle at play here is attenuation, which is basically the gradual loss of intensity of any kind of flux or energy as it passes through a medium.
Oh, like sound waves traveling through a house.
Precise.
Like if I have a massive speaker blaring heavy bass in the living room, the walls of that room are going to vibrate. That's the vaginal cavity absorbing the RF energy to build collagen.
Right.
But if I have delicate jewelry sitting inside a thick, heavy steel safe in the back bedroom, the sound waves are going to attenuate. They're going to lose their energy long before they can penetrate that safe and rattle the jewelry.
That captures the mechanism perfectly. The bank vault defense argues that the specific frequency and penetration depth of the RF energy radiating from the vaginal wand simply cannot cross that thick cervical barrier.
I see.
Because the energy never actually reaches the copper wire inside the uterus, the free electrons in the metal never oscillate. The copper stays cool, entirely protected behind the vault door.
Okay, that makes absolute anatomical sense, but there's always a but, right? Thermiva's own documentation notes a significant exception that patients need to understand. They bring up uterine prolapse.
Right.
This is a condition where the pelvic floor is weakened, often after childbirth, and the uterus actually drops down into the vaginal canal.
Yeah, and when the anatomy shifts like that, the bank vault door theory gets incredibly complicated. The uterus and the metal IUD inside it have essentially slid down into the room where the RF energy is being actively applied.
The safe is in the living room now.
Yeah, exactly. Interestingly, though, Thermiva's FAQ claims that even in a prolapse state, the muscular wall of the uterus itself is thick enough to attenuate the RF energy and protect the copper from heating up.
Wait, really?
Yeah, but having said that, they still advise against treating patients with severe prolapse for a host of other medical and structural reasons anyway.
I mean, if you are relying on this procedure to heal your body, this conflicting information is just maddening.
Oh, it's completely overwhelming.
One camp says the physics of metal conductivity will burn you. The other camp says the anatomical attenuation of your cervix makes it completely safe. So I went looking for a tiebreaker in our sources.
A referee.
Exactly.
Yeah.
I wanted to know what the ultimate authority, the FDA, and the actual manufacturer of the copper IUD says about this specific interaction.
And the FDA prescribing information for the Paragard Copper IUD actually does contain a specific section addressing medical diathermy, which encompasses the shortwave and microwave heat therapies.
It does. I pulled the exact label, and initially it totally validates the strict ban from those Denver and London clinics. The official stance reads, and I quote, "Theoretically, medical diathermy in a patient with a metal-containing IUD may cause heat injury to the surrounding tissue."
So they acknowledge the risk.
They're officially acknowledging that selective heating is a real physiological threat.
Hmm.
But then I read the very next sentence, and my jaw just dropped.
With the caveat.
The caveat is staggering. Immediately following that grave warning about internal heat injury, the label states, "However, a small study of 8 women did not detect a significant elevation of intrauterine temperature when diathermy was performed in the presence of a copper IUD."
A sample size of 8 women.
8 women? I mean, we were talking about a medical device implanted in millions of women globally. You can't even field a baseball team with 8 people.
It's true.
A standard jury requires 12 people to decide a parking dispute. Yet the safety reassurance that a metal device won't burn your internal organs when exposed to localized microwave radiation is based on a temperature study of just 8 individuals.
Which, highlights a massive vulnerability in how medical protocols are established. When the foundational safety data from the manufacturer is that incredibly sparse, it forces individual clinics, doctors, and newer device manufacturers into a vast scientific gray area.
Yeah.
They're basically left to interpret the risk and decide how much liability they're willing to take on themselves.
And we see that gray area playing out in real time in the clinical guidelines we reviewed. Practitioners are essentially passing the buck back and forth.
Oh, definitely. Take Optomantra, for example. They provide platform guidelines for practitioners using advanced RF devices like Forma V and Morpheus 8V. Their documentation attempts to straddle the fence.
Right.
They state that metal IUDs are often safe if not in the path of RF. That clearly leans into the bank vault defense, acknowledging that if the anatomy protects the metal, you're fine.
But they refuse to make it a definitive rule.
Exactly, because in the very next breath, Optomantra's guidelines advise the clinician to ultimately check manufacturer safety. They deflect the final decision.
Meanwhile, we look at the internal protocols for a clinic called Stern Laser. Their rules state practitioners absolutely must not use metal-containing IUDs without explicit manufacturer confirmation.
It creates an endless loop of liability.
Completely.
The clinic defers to the RF device manufacturer. The RF device manufacturer defers to the IUD's FDA label, and the FDA label shrugs its shoulders and points to a study of 8 women from decades ago.
It places the entire burden of this incredibly complex biophysical decision squarely on the shoulders of the individual nurse practitioner or doctor standing in the room with you.
Yeah.
They have to evaluate the specific trajectory of their specific RF wand, guess the exact position and thickness of your individual cervix, and decide if they want to gamble on the bank vault door holding up against the radio waves.
Which really brings us to the most important part of this deep dive. We've explored the physics, the anatomy, the regulatory loopholes. But what does this mean for you, the listener?
Right. Where's the patient stand?
If you have a copper IUD and you want to utilize RF vaginal tightening to improve your quality of life, what do you actually do?
Well, the primary takeaway across all our sources is that having a copper IUD does not automatically disqualify you from these therapies. However, your eligibility is not a universal medical standard. It's a highly localized decision dependent entirely on the specific clinic you choose and the exact brand of RF device they operate.
Exactly. Some providers, like those using Thermova, firmly trust the anatomical attenuation of your cervix. Others, utilizing devices like Empower RF, prioritize the fundamental physics of metal conductivity and will view your copper coil as a strict, non-negotiable hazard.
And because the medical community isn't going to protect you with a unified voice, you have to be your own most aggressive advocate. So if you're walking into a consultation, there's highly specific, actionable advice you need to follow. First, you must proactively and explicitly disclose your copper IUD.
This is so crucial. Do not assume the practitioner will automatically know, and please do not assume it's covered by merely checking a generic birth control box on an intake form.
Right, because hormonal IUDs are different.
Exactly. Hormonal IUDs, like a Mirena, are made purely of plastic and do not conduct heat in the same way. The metal is the critical variable. You have to clearly state the word copper.
Second, you need to interview your provider. Ask them directly about their specific RF device's manufacturer guidelines regarding metal implants, and listen to how they answer.
Yeah.
Are they confidently explaining the depth of their device's energy penetration, Do they mention the cervix acting as a barrier?
Mm.
If they seem unaware of the debate entirely, that is a massive red flag.
Huge red flag. And finally, if a provider does approve you for treatment under the bank vault theory, you must insist that they physically verify the proper placement of your IUD before the machine is ever turned on.
Wait, why is that step so important?
Because, IUDs can shift.
Oh,
Yeah, they can slip down into the lower segment of the uterus or even into the cervical canal itself. If your IUD has slipped, that protective bank vault door is essentially propped open.
that makes total sense.
The copper wire is now directly in the path of the radiofrequency energy, completely destroying the anatomical defense.
Wow, okay, so a quick pelvic ultrasound or a thorough physical check of the strings by the clinician is absolutely vital. It ensures the copper is tucked safely away at the top of the uterus, far from the thermal energy.
Exactly.
It is genuinely wild to realize how much variance exists in something so deeply personal.
It really is.
We rely on these incredible science fiction level technologies to manage our bodies. We implant devices that utilize the chemical properties of heavy metals to control our fertility for a decade at a time.
Yeah.
We use wands emitting targeted electromagnetic radiation to rebuild our cellular structure and restore our pelvic floors.
And, these are profound marvels of modern medical engineering that drastically improve women's daily lives.
They really are.
Uh,
But considering that the foundational safety reassurance for combining these two marvels rests on a temperature study of just 8 women, doesn't it make you wonder
oh, absolutely.
how much of modern female medical technology is currently operating in this kind of vast scientific gray area, just waiting for comprehensive research to finally catch up to what women are actually experiencing in the clinic?
We operate under the assumption that the rules of medical science are written in stone, but looking closely at the sources reveals that the stone is, well, it's still actively being carved.
Beautifully put. So until the research provides a definitive, unified answer, keep asking the hard questions, keep reading the fine print, and make sure your doctor knows exactly what is happening behind the vault door. Thanks for joining us on this dive.